But what you do have to prepare for is the cultural change. And, in our daily practices, we see the sign on the door, the chart on the door, and it says, Mrs. Jones is in today for a rash on her torso. And you already start to think.
Yep.
And so I was in Malawi with four of my very dear friends who are all, this was a Durham only trip. And we were sitting around at the end of the day comparing notes. And somebody said, oh, I saw this lady with this really terrible itchy rash on her torso. And I said, oh, I had a lady that was so dehydrated, she was barely, and someone else had a lady with a rash on her neck. And we got to chatting and we realized we had an epidemic of these dehydrated, demented, dying, dermatitic patients who all had pellagra,
Oh my
which was on
gosh.
nobody's list
Yeah.
because we never see pellagra. Well, it turns out all of the fish in Lake Malawi have schisto, and all the cows have brucella. So nobody eats fish or meat; they all eat rice, corn, and paint chips. And so, the
There's your
the
deficiency.
public health cure
Yeah.
is let's bring a bowl of Wheaties once a month,
Yeah.
and you're fine. But again, so you just have to be open-minded, and it's fun to have these little mini grand rounds. Now, having said that, we see a lot of acne, psoriasis, eczema, the normal stuff as well.
Yeah.
But you also see some things that you would not even be in your differential, in North America.
I can imagine people listening to this would be interested in joining and can see the benefit professionally, personally, just for your soul as well. What's it like when you join a trip like this? I know there's some payment involved, right? Like you have to pay your way to do this. It's not
Yep.
supported in any other way.
Yep. So right, we're pretty happy that we don't take any money from the government. We're pretty pleased by that. This is all self-funded, and the good news is, and our medical students, they either can do it curricularly, like through their school, and then bundle it through through their student aid. And a lot of people that go are like my age and older, and so we have a little foundation that helps that kind of thing as well. There's really no requirement like sweat equity or anything like that. And we encourage people like to look at our website, powerofanickle.org. But we do usually have, people typically don't say, let's go in a week. They think, oh, I'm going, it's not like, let's go to Boston or let's go to Ireland. You got to,
Right.
you got to get a yellow fever shot, et cetera. So we talk about having 3 or 4 hour and a half webinars with the whole group. So everybody kind of knows everybody's face, that kind of thing. We talk about some custom things, like it's a good idea if you're going to a third world or a non-industrialized country to not have a T-shirt that says, wow, the Philadelphia Eagles are the best, and boy, we're the best people in the world, that kind of thing. Have unbranded stuff. Yeah. We talk about like the biggest question we get, the first question is always safety. Is it safe to go there? And I live in a small town in Ohio, and I tell people I feel safer in Uganda than I do in some places in my little town. Okay. So we talk about safety. We talk about the group, just like you're going scuba diving. You got to have a buddy. Don't just wander around, by yourself. We talk about what volunteer sort of supplies one can bring. And again, a little about just the cultural mores. For example, there are very little medical records that a hospital keeps. And many patients have never seen a doctor, never. So like a patient walks into a room in Austin, Texas, or in Marion, Ohio, you say, hi, what can I do for you? And they say, oh, my left foot hurts, or I have an itchy rash on my left ear. And there, people just don't have any idea what you can do for them. And they don't understand the dynamic of what a doctor visit's like. And you say, what medicines have you used? Well, a leaf of that tree, or the salve that my grandmother made, so it's a whole different thing, and it requires a lot of listening. Yeah. And we always partner with local in-country healthcare providers, because they just do things differently than we do. And we have to listen to them because they, for example, in the Kipsigis tribe in Kenya, your scalp hair is part of your marital gift to your spouse. So you would no more show your scalp to a stranger than you would walk in naked to your son's baseball game. Like, it's just not a thing. Well, of course, you don't know that until Scotty Drew walks in and says, "Oh, what's wrong with their hair?" and rips the hat off, right? And
Oh
so
gosh.
you have to have someone help guide you through this process.
Okay.
So it's quite educational for you individually to see how different things are done, because we think, oh, you've got psoriasis, what's your BSA? Do you have any joint pain? How are we going to approach the way we're going to holistically attack this systemic problem? And that's not the way everyone thinks about healthcare. Not to mention the resources you and I have are just logarithmically more